Despite veterans putting significant value on oral health, they do unfortunately experience poorer health outcomes than non-veterans. So how can we bridge this gap? The National Veterans Foundation clearly defines 6 guiding principles for trauma-informed care when it comes to veterans. Trauma-informed care is an approach that your healthcare team can take on acknowledging you as a patient, not just your present life, but also your past life. Shifting the mindset of what is wrong with you to what actually happened to you. Safety. Safety can sometimes be the most important step when providing trauma-informed care, because a lot of times trauma is associated with being in an unsafe environment or being in an abusive relationship. The veteran must feel that they're safe in their environment. Ways that I like to exhibit safety in my dental op is making sure that my patient is comfortable. I like to check in with them and say, is everything doing okay? Are you doing okay? Making sure that my patient feels safe throughout the whole procedure. Maybe it's loud noises they don't like and we can use headphones or things like that. I don't want to bring them back to maybe the trauma they might have with that PTSD. Choice. A lot of veterans that deal with PTSD often feel trapped with no real options, lost in their environment with no control over the situation. That is why it's so important with trauma-informed care that your patient has choices so that they feel like they have a say in what's going on and not trapped in a situation. An example that I like to use in the dental op for choice when it comes to my veteran patients is maybe time of day for their dental appointment. Are they going to be more consistent coming in the morning or the afternoon? Maybe time of day plays a lot into their emotions and their mood, making it a better appointment for not only for my veteran patient, but also for me as a dental hygienist. Collaboration. A lot of veterans that deal with PTSD experience a very isolating experience. The collaboration allows them to have a voice and know that they're not alone. It helps to build resilience when they know that they are working with their healthcare provider on helping to determine together what their treatment might be for the healing process. Ways that I like to implement collaboration within the dental op for my veteran patients is working as co-therapists. Things that they do at home that I do in the dental op, we need to be doing together, to collaborate together, working as a team. Trustworthiness. A lot of veterans deal with PTSD, post-traumatic stress disorder. They need to be able to feel that they can trust the person that they're talking to, confide in them, and that they have their best interests when they're sharing intimate details maybe on their past or just going over healthcare concerns. Ways that I like to exhibit trustworthiness in the dental op is being a listening ear to a lot of my veteran patients. Over the years, I've had a lot of my veteran patients share very intimate details on their military experiences or maybe even combat. I like to not judge, be a listening ear, and not talk over the patient. Peer support. Peer support is effective when establishing rapport and trust. In the military experience, especially for those that are in combat, it is far from what civilians will experience. Therefore, it is extremely difficult to establish rapport. Having a peer helps to build an open and safe relationship. Ways that I like to exhibit peer support for my veteran patients at dental op is a little bit more difficult. I am not a veteran myself, so what I like to do is offer the services that might be offered in my town, recommending that maybe they reach out to any veteran service that we might offer, going to places or clubs like the VFW or maybe the American Legion, offering any advice that I might be able to give, or maybe some ways that they can reach out to somebody that is a peer support for them. Empowerment. A lot of veterans dealing with PTSD have a sense of worthlessness. It's really hard to move forward through the PTSD if you're not feeling like you have any power in the situation. When you're working with your veteran to make them feel power and have a voice in it, it's only going to help the process for trauma-informed care. Ways that I like to exhibit empowerment within my dental op for veteran patients is building the patient up with positive reinforcement. Say I'm seeing that veteran patient back and their oral care at home has greatly improved. I want to build them up with positive reinforcement that's going to empower them to want to do better to still achieve those oral care goals that they have for themselves. As a dental hygienist, I feel extremely honored to be able to serve those that have fought for our country and served in the military. That is why I take trauma-informed care so seriously, and you should too.